Welcome to the Revolution Dentistry Podcast. Welcome to another episode, a quick one, of the Revolution Dentistry Podcast. We're number one in all things practice ownership and implant dentistry.
Sweet.
Today, we have with us Dr. John Bigler, who is from Mesa, Arizona.
Yeah, thanks, Cassidy.
Okay, yeah, we're really happy to have you on with us right now. And if you could just quickly introduce yourself to our listeners here so that they know who they're dealing with.
Dr. John Bigler, excited to hang out with these guys. We're actually in Texas at Closing Institute, which is pretty cool to be down here. And I've been in practice in Arizona for about 25 years. Have a pretty good sized practice. I think you've been to the practice.
It's beautiful.
You have a good practice there.
Yeah, Canyon Vista.
Yeah, they're at the foot of the Superstition Mountains, right? So we like that.
It's a great view.
And I've been doing implant dentistry for the majority of my career, honestly. And we're recently opening up a training institute in Mesa, and focused and wrapped around dental implants. So Okay,
awesome. Tell me a little bit about that. What inspired you to open up that institute and kind of what goes on there?
Oh, there's a story there. I mean, that could take a while. You only said we had a few minutes.
No, we got some time.
No, I think over the years, I've had multiple associates coming through my office, and what you find, even in the world of implants, and I think most implant salespeople would agree with me, is that, you go to one course, you get their kit, you kind of get jazzed up about this implant, and then the next thing you know, you're back in your office, and you're like, okay, so I just paid a bunch of money. I need to put an implant in somebody's mouth. I got to do this thing. But there's no follow-up, nobody to call and check with. Kind of continuum. So that's really what we're trying to put up.
Like a continuum where someone can, reach out to you even after the course and have continued support so that when they go back to their practice, they're not alone, or if they wanted to work with you on whatever projects or practices you got going on, then you've got a trained dentist who is capable of, placing implants and doing all on X.
Correct. Yeah, that's the idea, especially from, we've got kind of two programs going right now. One is what we call a fast start, which is for guys that are placing AOX. They're just doing a couple here or there, and they really want to fine-tune the system. And then sistered onto that is a SprintRay course. So being able to use the dental implants with a printed SprintRay in your office.
Wow.
So that's kind of a fast start course for guys that are already placing but are wanting to kind of take it up the next level, do more, start marketing, that kind of stuff. So we've partnered with a group, and we have a marketing arm that can come in and really market. So some of that kind of stuff to really get guys who are actually placing and reaching out their community. So that's kind of the first level.
Okay, I love it.
What are some golden nuggets of advice you can give to a dentist that's looking to add implants into the practice and start placing implants?
Take your time and find a good implant that's got a good support system. Your support system is probably more important than the implant nowadays. Okay? Now, there are a couple of implants that are really innovational and are headed digital. There's only one that I know of, TRI Implants, out of Switzerland, that really integrates digital dentistry and this printed prosthesis that we're able to do with SprintRay.
Okay.
So take a hard look at that, but really finding somebody where you've got some support behind you.
Okay, I love that. So you mentioned TRI, and I've heard a lot about their, implants and their all-on-X system that they have. They're abutmentless, right? Yeah. And so what can you explain a little bit about that system in terms of not having a multi-unit abutment to it and how that might affect the patient experience, the dentist's experience when learning how to use that system? Does it make it more simple? Does it?
Yeah, that's a great question, and I wasn't really necessarily trying to do a TRI sales pitch, but I kind of am, right? So I started working with this implant about a year ago, and totally changed my practice.
Okay.
So, and it's enabled me to train some associates and get them doing AOX much quicker. So what we realized with implant dentistry, going through school and everything you were taught, minimally invasive, do the least amount, right? We want to take the least amount of tooth structure. And then we went into this AOX field, and it's like, okay, now you're going to take off 5, 6 millimeters, 12 millimeters of bone for this prosthetic space, right? Yeah. And most doctors, when I talk to them, the biggest thing about doing AOX is like, I don't want to flap somebody all the way open and take away all this bone.
It's terrifying. I mean, I'm
Yeah.
a general dentist. That sounds, intimidating.
Yeah, it's a big jump, right?
Yeah, it's a big jump.
From going to place 1 or 2 implants to, okay, we're going to open this flap, we're going to saw off a bunch of bone, and then put implants. That's kind of a jump from a learning standpoint, and even, I don't know, I call it a pucker factor, right? It's kind of like, do I really want to do this? And then if I do it, what happens if I'm in the middle of it, right? So those are the questions that go into it. And this, I think that TRI, again, it's a Swiss-based company, and Chris Luter is the president of the TRI US here. And I met with him the other day, and I told him this, and I truly believe it. The TRI implant platform is probably the only real innovation in implant dentistry in the last decade.
Okay.
Because think about every other dental implant company, they come to you, the sales guy, and he's like, hey, we have a surface that's been acid etched with XYZ, right? Yeah. And the next guy's like, hey, but we acid etched ours with Z and X.
Yeah, We've got more aggressive threads.
Our threads are more aggressive. Ours are less aggressive. They haven't changed a lot, right?
Yeah.
And historically in the past, we started out with like full tissue level implants. Okay, that was a problem. We got a recession, right? Yeah. So then we all said we don't like that. Bone level implants. Oh crap! Now we got all these components we're sticking in there.
Yeah.
Right, and they all leak and cause bio problems and screws loose.
Yeah.
Finally, somebody thought, let's meet in the middle.
Yeah.
Let's do a bone level implant with a little bit of a tissue cuff. And so that's what they've done. It's got a 1.5 millimeter tissue cuff.
Love it.
So you can drop that below the tissue. Mm-hmm. So we have the aesthetic problem solved.
Extended collar, pretty much.
Yeah. And so the biologics are so sound. It was awesome. But then they took it to the next level. And that abutment is structured so that it can receive a printed material. Mm-hmm. And to date, they're the only FDA-approved implant that can take printed materials direct to implant as a long-term prosthesis.
Wow.
So we're able to do that in the office, right? So we're able to do the surgery, scan it right there in the office. Mm-hmm. Intraoral scanner, by the way. They made a scanner that you don't need photogrammetry. Don't tell my buddies in sales, okay? Don't tell those guys. But you can go direct to implant with your printed prosthesis. Mm-hmm. So my workflow is bring the patient in and do the surgery. While they're waking up from anesthesia, we're printing that thing.
Yeah.
They come out, they're awake, they're looking at you, and you screw it in. They're like, wow.
Oh my
and the
gosh.
wow factor, I've seen tears, dude. That will change your life and change your practice. When you see somebody break down in tears and hug you because they now have teeth when they went to sleep they didn't.
It's crazy.
It's cool.
That's life-changing. That's why we're all here.
No, it's
That's
awesome.
why we're all here. And you mentioned something about 3D printing and the indications for it.
Yeah.
That sounds like that's the future.
Absolutely. So we've done a group kind of partnership with SprintRay.
Okay.
And in fact, in May, we're going to do a course all on SprintRay. So 2 days worth of SprintRay.
Where's this course at?
It's going to be in Mesa Institute, and we're going to go, start to finish. We're going to start out with like, hey, how do you print, Essex retainers,
Yeah.
all the way from that to printed prosthesis for All on X.
Yep.
And so it'll be a 2-day, really intensive on how to use this SprintRay. I mean, again, SprintRay is just like dental implants. You get them, you try it once or twice, you don't know what you're doing, and you leave it on the shelf. Yeah. Like there's a lot of guys who have really expensive equipment sitting in their office, and they might print temporary crowns.
Retainers.
They might print retainers, or they might print dentures, but none of them are knowing how to do all of them. They kind of get one thing, they learn it, but to go and get the training is super expensive.
Yep.
I mean, I think SprintRay's training is like $10,000.
Oh my gosh.
Like you buy the SprintRay, then you get and we're doing this course for $2,500, $3,000 to come in for 2 days and get hands-on training. It's going to be awesome.
So, where can someone go to register for your institute if they are interested in learning this stuff that you've just taught? TRI, SprintRay, and you did a great job at explaining the benefits of both of these systems. So your institute teaches these systems. Do they teach additional?
Yeah, we're in the fall. We're going to start a continuum for guys who haven't really placed implants, kind of a 0 to 60.
Love it.
We'll probably we'll use a couple of different implant companies. Probably use a little bit of Neodent, TRI,
okay.
And Zest locator type stuff.
Okay,
probably in
great.
that one. So it's kind of a variety to start with, so somebody
it.
can get a good basis.
Love it.
And then that continuum will have 4 courses in it, and which will end with, now we're doing an AOX. So
okay, yeah.
those will be, the courses will be interspersed with live patients, and not live patients watching me do surgery. We're going to bring in patients for the doctors to do the surgeries in our institute.
Love it. Okay, so we got live patients, we got the full experience.
And we're excited about that. That's going to be an outreach to all of our patient pool, because we're doing it as a charity deal for our vets.
Oh my gosh.
So it's a reach out to the community for vets that are having a hard time getting care.
Yeah.
And then the doctors, as they're coming through the institute, will be able to treat these vets and work on them.
That's powerful.
Yeah,
that's
I think it's really cool. It's a cool program.
That's a really cool program that you've set up.
Yeah, we're excited for it.
If someone wants to reach out to you, register for the institute, ask you questions, where can they reach you?
Honestly, there's a couple of places. Website, Bigler Institute of Reconstructive Dentistry, or BIRD.
Okay.
They like to call it.
so Bigler Institute of ReconstructiveDentistry.com?
Yep.
Okay.
Yep. I don't mind a text message. You want to send me a text?
Yeah, okay.
Phone number's 480-221-2263. That's my direct line. I'm happy to reach out to people. It's a great program, and really this is part of me kind of getting my give back. It's like you want to do something impactful in your life, and I see this as being able to give back not only to the dentist, but also the community too. So pretty excited about it.
Thank you so much, Dr. John Bigler, for
Thanks
joining us
on
today.
The show, man.
This was
awesome.
so much fun. You want to sign us off?
Sure. Thank you again for being on. This conversation was incredible, just super powerful. So thank you for
awesome.
coming on here.
Hey, appreciate you guys doing that. Reaching out to a lot of the young audience, and honestly, you guys are the ones that we're talking about, right? Some of us older guys, like, okay, I'm kind of in my groove, but honestly, being able to get young dentists to go from 0 to AOX within a year span, that's exciting. That's pretty cool.
Oh, yeah.
And that's what I'm excited
Couldn't
about.
agree more.
Absolutely. Guys, this has been the Revolution Dentistry Podcast. Thank you for tuning in. We're here every week to help you grow, and we'll see you next time.
All right, thanks, guys. Appreciate it.
Hey,
thank you guys.
So much fun.
All right,
Thank you.
awesome.
Thank you.